Hello, everyone. My name's Eliana Monteforte. I'm the Civil Society Engagement Mechanism Coordinator. I'll be presenting and also moderating the discussion for today. You are at the Post-HLM on UHC webinar. I have here two other presenters, Ariana Childs-Graham. She's on the CSCM advisory group, and then also Amy Bulldozer-Bosch, who's the CSCM technical focal point. Before we begin, I just wanted to remind you, as I've written in the chat, that we will only be taking comments and questions during the discussion portion of the presentation at the end. We'll try to leave 30 to 20 minutes for that, and we'll only be taking them through the chat box. So if you do have a question or a comment, please type them in the chat box, and then we'll read them out loud. We'll try to get to as many of them as possible. Whichever ones we don't get to, we can always follow up with you over email. So with that, I will go to our next slide. Here is an outline of our presentation. I'll quickly go through information about UHC 2030 and the CSCM and what the high-level meeting is and its implications at the national level. Ariana will take over and then talk about the UHC 2030 key asks and the political declaration, and then also the CSCM priority asks. Then we'll go over the political declaration and then what the follow-up is going to be post the high-level meeting. And then we'll have our discussion. So here's some information about UHC 2030. We have links throughout the presentation that you can click on to get more information about UHC 2030. This presentation and the webinar will be available on the CSCM website. We'll be sending that information, so just know that you'll have access to all of this. So the UHC 2030 mandate is it provides a multi-stakeholder platform to promote collaborative working in countries and globally on health system strengthening. And it also advocates to increase political commitment to universal health coverage and facilitate accountability and knowledge sharing. Here are a few activities that UHC 2030 covers. Again, I won't be going over this in detail, but you'll have access to them via our website, and then also you can learn more about their activities on the UHC 2030 website. So some more about UHC 2030 and how it's governed. It's hosted by WHO and World Bank. It has a steering committee that provides all of the oversight and decision making, and here are all the members that are on the steering committee. What's important to note here is that the CSCM has 3 steering committee representatives that sit actively on the steering committee, and then we have 3 alternates. So if any of our own steering committee active reps can't attend, we have alternates that can attend the meetings. If you want to learn more about the partners for UHC 2030 or learn more about the Global Compact, you can click on these links here. Now about the civil society engagement mechanism. So we're the civil society arm of UHC 2030, and our mandate is to raise civil society voices in UHC 2030 and ensure that all UHC policies are inclusive and equitable so that no one's left behind. We do that through various activities. Here are some: by influencing policy design and implementation, strengthening a lot of the citizen-led social accountability, participating in policy development and implementation, promoting coordination of CSO platforms at the national, regional, and global levels, and then also knowledge creation on existence and sophistication of existing national level infrastructure for civil society on UHC. Some more about how CSCM is governed. We have an advisory group. You can access a list of our current advisory group members on our CSCM website and learn a little bit more about them and where they sit, what organizations they belong to. One of our advisory group members, as I mentioned at the beginning of the presentation, will be presenting also today. And then in terms of our membership, this needs to be updated because we've had a surge of applications for memberships in the past few weeks. We're actually up to over 1,000 individuals now from over 800 organizations and from probably over 100 countries at this point. So we're definitely growing. So what is the UN high-level meeting on UHC? Again, you can click here to learn more about it, but it's convened by the UN General Assembly. And on the 12th of December in 2017, the UN passed a resolution that decided to hold a UN high-level meeting on UHC during the 2019 UNGA. And the purpose was to reach agreement and cooperation measures and solutions on important UHC issues among heads of state and governments. And as many of you know, the meeting took place on the 23rd of September, and in the lead up to this meeting, civil society voiced a lot of their priorities so that these members of state, when convened at this high-level meeting, would be able to make those a priority and really make commitments to close some of the UHC gaps that civil society pointed out. And to that end, I'd like to also talk about why it's so important at the national level. So as I mentioned before, a lot of what happened pre-HLM was a lot of the civil society met with their governments, participated in different surveys, different activities to influence their governments on what UHC approaches they should use and what some of the UHC gaps they should prioritize in their commitments are. So they advocated with their governments to make sure that they attend the high-level meeting and also to set realistic commitments to UHC. Right now in the post-HLM, what we're really focusing on here is how are we now going to hold our governments accountable for those commitments after the high-level meeting on UHC. And this is primarily what our discussion today is going to be about. So Ariana, I will pass the baton over to you so you can continue with the slide.
Thanks so much, Eliana. I'm just going to walk through some of the key asks that were articulated through a consultative process that UHC 2030 spearheaded. I think one of the things that we won't focus much on today is really kind of the process behind how we got to the political declaration. Certainly there was a recognition of some of the things that were aspirations to appear in the declaration that did not surface. And we'll focus primarily on the aspects that did have a foothold in the final draft of the declaration, really focusing on what's actionable moving forward. The first ask on political leadership beyond health, focusing on wider determinants, government capacity to lead, this whole of government and society, which from a civil society point of view is really critical. Civil society actors played an essential role in activating and mobilizing governments to show up to the high-level meeting, and certainly will play a role in working with government in acting on those commitments. The focus on UHC and emergencies, the member state political momentum, quality needs-based interventions, primary healthcare, certainly building off of the momentum of the Global Conference on Primary Healthcare and the Astana Declaration last year. And again, this notion of being people-centered, looking at the health workforce as well as the capacity. The second ask, leave no one behind, and just as a side reference, the Civil Society Engagement Mechanism created a commentary on the UHC Global Monitoring Report with a focus on Leave No One Behind. So again, that's another resource that you may want to consult and think about as you're shaping your advocacy approach and objectives. Under the Leave No One Behind ask, focusing on the access to medicines, healthcare workforce training, and the, to better equip them to meet the needs of vulnerable groups. And again, access to health information, the disaggregated data, and health systems needing to reach vulnerable people. Looking at, what populations, what communities have access, and those that are still struggling to receive quality, equitable access. Nationally appropriate spend targets. Certainly the financing piece is a complex, I won't say complicated, a complex ask. There is no sort of single ask here, and ensuring that there's a connection to nationally appropriate spend targets and sufficient public spending. Again, a focus on, regardless of the percentage or dollar amount, which certainly matters in the context of the financing conversation, but also looking at the split of where the financing is coming from, and wanting to shore up the public spending. Adequate finances, and again, using those finances effectively. The third ask on regulations and legislation around effective institutions and legislative frameworks. I'm just sort of walking through these quickly. Multi-stakeholder platforms, and again, this whole of government and society approach. The CSCM also articulated a set of priority actions to complement the key asks that were articulated through the UHC 2030 consultative process. And again, these are to reinforce those asks and focus on actions to be taken. These center around increasing public health financing and financial protection, leaving no one behind, and reaching those left behind first, as committed to in the Sustainable Development Goals. A focus on health workers, both paid and unpaid, growing the health workforce and looking for more equitable policies and approaches, and engaging civil society and community in the UHC implementation to ensure accountability. I'll walk through an overview of the high-level meeting on UHC and the outcomes. The political declaration was agreed to by consensus and includes priorities that we can use in shaping advocacy, building off of the momentum of the high-level meeting. There is a reference to the right to health as the first principle, a mention of non-discrimination, leaving no one behind, and social determinants of health, which reinforce the Agenda 2030. Also, this use of promotive, preventive, curative, rehabilitative, palliative, essential health services, which covers a broad range of services. Again, moving away from that focus on preventing death and to more of a focus on promoting health. There's a strong focus on health workforce, community health workers, women health workers, looking at the gender dimension of the healthcare workforce, protection and pay. And despite the many challenges around the sexual and reproductive health and rights and migration language during the negotiations, there was language around these issues that was included and could be qualified as being not regressive. Some other outcomes, including mentioning the role of civil society and citizens and communities, the need to empower people to improve and protect their health, and the need for partnerships in taking UHC forward. So while governments and public sector need to be the hub and drive momentum, bringing together multiple stakeholders, that progress is reliant on civil society and communities, and a recognition of the role that civil society and communities will play. The need to strengthen policies, legislative, regulatory frameworks to achieve universal health coverage. Again, when thinking about how this translates at the country level, there is no single kind of policy or financing package or health benefits package for health insurance that can be applied across different country contexts. But we can look to this support and commitment around the need to implement country-specific policy frameworks. A focus on data and country-level accountability calls for national targets, monitoring, and tracking progress. Again, embedded within the political declaration is a reinforcement of country-owned, country-driven accountability. Health financing, including out-of-pocket payments and the need to decrease out-of-pocket payments, domestic resource mobilization, and investing in primary healthcare and people-centered community-based health systems. And looking at some of the follow-up to the political declaration at the global level, there will be a progress report in 2020, 2021. report with recommendations on political declaration implementation in 2022-23. And again, 2023 is the halfway point towards achieving the 2030 SDG targets. The high-level meeting in 2023, the scope and modalities to be decided in 2020 and 2021. Regarding national accountability, engaging all stakeholders in the development, implementation, and evaluation of health and social-related policies, and reviewing UHC progress. Setting measurable national targets and strengthen national monitoring and evaluation platforms. As Eliana mentioned, we have some time, and thankfully we have some considerable time for the discussion. And just scrolling through and looking at the many participants that are on this webinar, this conversation today, really want to capitalize and invite not only questions, but your insights, sharing updates about work that's either in progress or plans for taking different work forward around shaping advocacy objectives, engagement with government, engagement with multiple stakeholders. So really want to invite not only your questions, although if you have questions for other participants that are on the line as well, would welcome those as well. But really want to shift gears from planning for the high-level meeting and thinking about the shaping of the agenda for that and the political declaration to a more decentralized approach that's focusing on country-level action and country-level priorities. So we'll move to the discussion, and we'll start with the first question around what are the advocacy priorities in your country?
Thank you, Ariana. And I do just want to let people know, when you type a question in the chat, make sure that in the to section, it says everybody, that way, or everyone, that way everybody can see your question. I'll still read them out loud. But some of you are sending messages privately to me, and not all people can see those private messages. So I see a comment from Thomas Schwartz. Find some critical analysis of both the HLM process and the outcome on our Medicus Mundi International Network here. So that's another great resource. You have the link there. Thank you, Thomas. Appreciate that. While we think about answers to this first question about what your advocacy priorities are, I do just want to mention that for UHC Day this year, the theme is Keep the Promise. The reason why that was selected as a theme is because we really want to start shifting, as Ariana said, to this focus of post-HLM, and how are we going to make these governments or keep them accountable for the commitments that they've made. And so we're really curious to hear from all of you, what activities do you have planned to hold your governments accountable? If some of you are even participating in the UHC Day activities, what are some of those activities that you're planning on doing that are highlighting certain priorities that you want to focus on at the country level? So a little bit of background on UHC Day. So it is an official UN day that we celebrate December 12th. And right now the UHC 2030 initiative is providing funds for microgrants. I believe that the applications for the microgrant process is already closed. But they're going to be issuing out microgrants so that civil society organizations around the world will be able to conduct certain activities related to advocacy for universal health coverage, particularly related to post high-level meeting activities. So this is something that you can find more information on our website. If you're already a CSEM member, you've probably been receiving a lot of information about UHC Day via email. You'll be receiving some more throughout. We have an actual microsite for UHC Day. So you can always go on the microsite. If you do have the link to that, you could post it in the comments so that people can access that. But even if you do not receive a microgrant for UHC Day, on the microsite you can actually submit what your activities are for that day so that we can highlight those in the website and share them with other civil society members. So I already see that we have a few questions. So from Busy Bright, Live Well Initiative. Question 1, in my organization, we regard ourselves as a CSEM partner, but we are not listed. How can we correct this? So we can make that correction on the map, no problem. At the Post-HLM meeting, some of us were named as CSEM coordinators for our countries. This is not follow-up TORs. Kindly advise on the way forward at the national level and the TORs. So I don't know if Ariana or Amy, you have any information on the TORs?
This is Ariana, and I can chime in about the follow-up to the in-person meeting. My understanding is that folks raised their hand as a kind of connector. I don't know that because we, at the time, were not in a position to create formal positions with TORs, but we're very much interested in accelerating connections with civil society representatives at the country level who are interested and invested in advancing a UHC advocacy agenda at the country level. Amy, I don't know if you want to talk about kind of the follow-up and next steps piece to that.
Yeah, I think that's right, Ariana. It was great to see the interest in the room of those who would be willing to help disseminate. And Busy, I know your organization has already done that through some activities on the ground. Happy to be doing that in partnership with the CSEM to help share the outcomes of the high-level meeting more broadly, including as you did at the community level. I think it's really something that came out of our meetings together, and that's always a goal of the CSEM to do, to make sure that, as I like to say, what happens in New York doesn't stay in New York, right? If we're going to talk about how we take forward advocacy and accountability work for the outcomes of the high-level meeting, and more broadly for the commitments that our governments have already made to achieving universal health coverage, there needs to be awareness at the country and community level of what those commitments were and what the opportunities are to connect with the CSEM and other networks, right, to receive information on how you may advocate about taking that work forward. As Thomas noted, and as we've seen from many of our CSEM members, there are different sorts of analyses that have been done on different priorities in the document, some of the things that were left out from the key asks. We've highlighted in the presentation today some of the things that would be helpful. It may be helpful for partners at country level to help the members of their own organizations understand for when you're meeting with the government or doing campaigns around leaving no one behind. Trying to be a bit of a clearinghouse, especially for those who weren't able to come to New York, to be aware of what those commitments were so that you can take them forward at the country level. So as Ariana said, we don't necessarily have a specific, there's not funding available or an intention to identify sort of one organization in each country that would be some kind of official representative, but rather encouraging you, as I know all of the partners have done in Nigeria and in other countries, to come together. If you're CSEM members, you should be able to see that on the map. If you're not on there through the membership process we did online, we'll follow up with you on that. That map is being updated regularly to help you also identify who are the other CSEM members in your country that you may want to engage in joint UHC advocacy.
Thank you, Amy and Ariana. I'll just add some 2 comments that we received in terms of the first question on advocacy priorities. From Tariro from Zimbabwe, UHC coverage is very low. It's only for a few organizations, if not only one organization. There is a need for awareness raising so that the message can reach everyone. Also, so I'm thinking of training of media and celebrities to raise awareness on the radio, social media, and newspapers. So that sounds great. From Neil, great. So he's clarifying to apply for UHC microgrant, please complete the application before 11:59, Thursday the 31st. So wonderful. If you all have interest in this, please visit the website. Refilo, I already included the link to that so that you can apply. You do this year as a prerequisite have to be a CSCM member to apply for a UHC grant, UHC Day microgrant. We're adding and reviewing applicants for CSCM on a daily basis. So that should take only a few hours to complete the application, and then we'll review it right away. And you should be getting an automatic email if you've been accepted. So keep that in mind. We have another comment. My name is Prime. I'm not going to try to pronounce the last name, sorry, from Burundi. Burundi is really one of the African countries with very low coverage. May I request that an extra effort or an extra strength be put in Burundi so as not to leave no one behind? I wish you should also encourage other INGOs working in our country to support, especially these days. We are facing serious problems of pandemics like Ebola and malaria. And then another comment from BZ, thanks. It's important to facilitate linkages between government and CSOs. Once this is done, possibly through WHO and World Bank at the country level, it will be much easier to get more corporate organizations to key into the Keep the Promise concept at the community level. We're happy to take the program to the next level if an initial government CSO forum can be facilitated at the country level. So I will just chime in here to say that we did actually conduct quite a few country level meetings in the lead up to the high level meeting. We did it in about 14 different countries, and that was an opportunity in many of the countries for civil society to actually come together with government to talk about what the UHC gaps were, and to really prepare them to think about what they should focus on when negotiating the political declaration. The results of those country advocacy meetings, we have some on our website in the news section. And if you want to learn a little bit more about the methodology that we used for conducting these meetings, we actually have a guidance document note that's available that you could actually download if this is something that you're very interested in doing in your country, and you can mobilize some resources to complete the meeting. You can use the guidance document that we have available. It gives you a planned agenda that you can adapt based on your country needs, and some other tools that you can use to help facilitate the meeting. So I do highly recommend that you go on our website to take a look at how we did those, what some of the results are, and download some of the tools that might be helpful for you. And maybe Refilo, if you can put in the link to that web page, that would be very helpful. We do have a comment from Javier Urcade, probably answering more than one question. We are working at the regional level Latin America. We covered the HLM since the presence of civil society from the region was at a minimum level. We just launched an e-group on UHC in Latin America. We also found the Global Action Plan for UHC led by 20 agencies and international organizations, and with 13 regional key populations networks reaching them to start discussing civil society engagement. We plan to target a few countries in Latin America for the UHC Day, and doing a lot of key UHC literacy through the regional key correspondent team, organizing webinars in Spanish. The region is quite behind, but we see traction and momentum. So this is really, really great to hear, Javier. We've really been trying to target Latin America as a region, in general to kind of promote more CSEM activity there. And I'm happy to hear that all of this is going on.
Yeah, and Javier is a partner of ours from the Civil Society Sustainability Network, a part of ICSS and GFAN, and it's been another example of where it's great. You know, the CSEM can help to mobilize organizations that may be working specifically on UHC, but that's also done through connecting with all sorts of other existing powerful civil society networks, right, that are advocating around various health issues for which achieving UHC is really crucial. So it's been great to have that partnership with GFAN and others, and particularly this ask around working in the region came up also for I know some of you who are on the phone today were a part of the side meetings that we had in New York. We know, as Javier is pointing out, it's been a challenge to mobilize partners, enough partners from all regions, right? So we certainly are committed to, you know, we've tried in some of the outreach around, as some of you may have seen, we are recruiting currently new advisory group members for the CSEM. We would really like to prioritize engagement from Latin America in the governance of the civil society engagement mechanism, as well as Javier is saying, outreach and broader participation with networks there. We do have existing materials on our website, including the previous HLM webinars that were done both in Spanish and French. And we're working now, we were able to secure funding support to do translation of parts of the website and some of the you know, the tools that are online to help engage both our colleagues who are Spanish and French speaking. Unfortunately, we don't have the resources to translate and make things available in all of the official UN languages, but we are trying to expand that work at the regional level and really appreciate and encourage the partnership of others who may be present there. I don't know, Ariana, just since Javier mentioned the gap, if you also want to we don't want to get into a whole separate conversation about the GAP specific work here today, but if you just want to flag the CSO group that we have working on the GAP in case folks are interested also in engaging in accountability processes around the Global Action Plan.
Sure, I can speak very briefly on that. So just to say, the Global Action Plan for Healthy Lives and Wellbeing for All, which was a collaboration, or to strengthen collaboration among multilateral organizations with the intention of accelerating country-level progress on achieving health-related sustainable development goals. So this involved Gavi, Global Financing Facility, Global Fund, UNAIDS, UNDP, World Health Organization, among others, about a dozen. And CSEM partnered with UNAIDS in convening the civil society task force around the Global Action Plan in its development. So again, to flag that as a possible opportunity for engagement and looking at country level objectives and advocacy and progress.
Thank you, Ariana. I'm just going to move on with some of the great comments that we've received from Amanda Livingston from the White Ribbon Alliance, Kenya. It will work to influence the national scale-up rollout of Afya Care, encourage formal integration of representational community engagement or citizen-led accountability mechanisms within Afya Care, inform the adoption of the Kenya Health Financing Strategy, and White Ribbon Alliance Uganda will work to inform the scale-up rollout of health sector integrated refugee response plan, i.e. inform and influence the formal revival of community participation within the HSIRRP planning and monitoring, advocate for increased national budget support for the health sector and local governments. Wonderful. Everybody can just please be on mute. That would be great. Okay. So in the presentation against the entry health information, you mentioned access to health information. The first relates to health data, while the second normally relates to availability of practical healthcare information for end users. Please, can you clarify which type of health information is being referred to? So Ariana and Amy, I'll field that question to you.
Sorry, unmuting. Let me take a quick peek, and then I'll look for that question and see if I can respond to that, unless, Amy, you have something at your fingertips.
I don't, Neil, I assume you're asking about the top line analysis of the political declaration, which is what we had highlighted on the slide, some of the key points that came out. I think we could take a look at the actual paragraph and the text in the HLM document from which that came, and share that with you. That may be a specific conversation to follow up on. Let us take a look, as obviously what we've put on the slide is just a brief summary of some of the key points that came up across the document.
Okay, thank you. So again, from Thomas, priorities from coordinated advocacy at the global level should be the result of a longer process of sharing and debating diverse and sometimes controversial civil society assessments of key elements of UHC 2030 key asks and the HLM political declaration, such as on public financing or addressing political and economic determinants of poor health systems and policies. What role could CSCM play as a convener and facilitator of such sharing and debating among ourselves?
Sorry, I'm unmuting myself. This is Ariana. I'm happy to respond to that. I mean, I think this is, the CSCM has a real opportunity, and really, when I say CSCM, I don't mean necessarily the Secretariat, but as CSCM members, that each of us can kind of put that hat on too, and think about ways that we are kind of holding that role within our own organizations, within the networks and coalitions that we work with. And, you know, I think there's certainly a value in continuing to feed to the global conversation and having a global dialogue. I would say that from my point of view right now, the priority is really facilitating those conversations at a country level. And so I think if folks are you know, looking to convene in person or convene conference calls or connect with partners that you work with at the country level, or would like to connect with new partners, you know, I think that the CSCM can play a role as a sounding board in thinking through how to cultivate those. You know, Amy did point a little bit to some of the unfortunately, the budget restrictions, and that those there is not funding available to support country focal points. But I think if you know, if there is an interest in convening those conversations, certainly CSCM as a thought partner in how to shape those, you know, what questions to ask, what kind of ways to connect to this high-level political declaration, and what the actionable advocacy agenda might look like. And just to say, there's not, or to reiterate, that there is not a single advocacy ask. You might focus on budget advocacy. A colleague working in Zimbabwe you know, recently convened a budget consultation in advance of the budget that will come out, the health budget coming out at the end of the year. You know, some multi-stakeholder convening, and is also thinking about the follow-up kind of once that budget is in place. Another colleague of mine in Nigeria convened a webinar in advance of the high-level meeting, and is planning to do an in-person engagement now following the high-level meeting to look at how to act on and how to prioritize different policy asks following the high-level meeting. So I think there's a real value in that kind of peer-to-peer exchange, and thinking through and shaping those agendas at the country level. So I think in terms of the ask of what can CSCM do, you know, I think CSCM as a thought partner is sort of top of the list, and also very much interested in facilitating, if folks have you know, sample agendas from meetings that they're convening, or share that the listserv is is open for everyone to share those and share that information and share examples of how you are shaping and carrying that work forward at the country level. Amy or Eliana, anything else to add to that?
Thanks, Ariana. And I think I appreciate that folks are sharing some resources for shaping that work at the country level, as you were just describing. I wanted to make sure people saw in the comments the opportunities to connect with HIFA, I hope I'm pronouncing that right, in terms of having both multilingual online platforms for information sharing, as well as the potential to share if you're engaged in UHC-focused communities of practice, where there are opportunities for civil society to engage. It would be great to know about what those may are. For some of the work with governments, there are active communities of practice organized under the Joint Learning Network for UHC. MSH is also the host of that network, but it's very government focused, and providing support directly to ministries of health, for example. So I think it's a great question around communities of practice where civil society may be able to engage or already engaging with partners, academics, and others. So if you have ideas, please do share them with the list. Eliana, I think there are a couple of other country level opportunities that are now being flagged in response to that question. Go ahead.
Yeah, so a comment from Sarah Lindsay. Communities at the Heart of UHC campaign is working to promote support on budget advocacy in Uganda, Kenya, and Ethiopia to help local CSOs hold governments accountable for commitments. We're also working to ensure community voices are included in national post-HLM meetings, and that information on the political declaration makes it all the way to the community level. So thank you, Sarah. So with that, I do want to move on to the next question. Again, if you have some other examples of what you're doing at the country level, certainly share them in the chat box. We can follow up with you all, and you can also email our csem@msh.org email, because that information we can then use to highlight the work that you're doing in our newsletter. So feel free to do that as well. So let's move on to what are the entry points for accountability efforts. Oh, here's another question on the political declaration. So let's see, Amy and Ariana, if you might have the answer to it, but it's from Bill Jeffrey. What plans are underway to ensure the conflict of interest safeguards mentioned in paragraphs 20, 54, and 58 of the political declaration keep food, alcohol, medical, tech, pharmaceutical, and fossil fuels companies are kept at arm's length?
This is Ariana. I'm not aware of any current plans, although I would look to the agenda for the upcoming WHO Executive Board meeting to see if that is, if there are any kind of actions or resolutions that are moving in support of that, is just my initial thought. But I think that that's certainly, to Thomas flagged a point about kind of this priority of global versus country in terms of coordinated advocacy. This does look like something that might be an actionable kind of advocacy focus at the global level. And just to clarify, I'm not saying that we should pick country level over global or global over country. I just think that in the follow-up to the high-level meeting, that there's a window of opportunity for advancing an advocacy agenda at the country level. So just that we don't miss that opportunity, and that we make distinctions between the things that can move and we should be moving forward at the global level, and what can be moving that are kind of country owned and country specific at the country level.
Thank you, Ariana. Just a comment from Patricia I'd like to read. Good morning, everyone. At the local level, we can create awareness, disseminate information on social media, do projects among vulnerable groups, collaborate with other groups on specific projects, and advocate for bigger budgets for primary health care. Great, thank you, Patricia. Any other comments on possible entry points for accountability efforts? I see a big comment that just came through. So the Access Challenge launched its 1x1 Target 2030 campaign to drive political commitment to UHC in Africa. We are currently working in East Africa and closely with the Ministry of Health in Kenya and are engaging with celebrity influences and communities through mass media campaigns. We work threefold through policy advocacy, mass media campaigns to raise community awareness and popular support for UHC, while also targeting behavioral change around common disease. This is coordinated with our civil society and government convenings we have on the global stage. At the country level, we seek campaign partners and advocacy support to help spread behavior change messaging and collaborate on market research to better understand UHC needs and perceptions at the local level. Thank you. Okay, great. From Hinlopen from Wamos, for those of you engaged in advocacy for health workforce issues specifically, please take a look at the Health Workers for All Coalition website. The coalition provided input for the UHC HLM political declaration. The link is there. The UHC agenda is an excellent opportunity to promote the health workforce global plans and strategy because it speaks to both global North and global South countries' responsibilities, especially relating to investments in domestic health workforce, health systems strengthening, and to ethical international recruitment practices. We do have a question from Bill Jeffrey. What about ensuring that global and national prevention efforts are robust enough to reduce the burden of treatable disease? Bill, can you just elaborate a little bit more on your question? I see from Prime, while he does that at the country level, we should also prioritize on advocacy, mapping, and coordination. Great. Another comment from Javier. I see 2 and 3 are linked. At the country level, we need urgently to foster dialogue across disease and other health themes, build a broader coalition of working groups to plan advocacy and discussion with our government around accountability. Also, the support and pressure from regional to national level works. And then I'll just take one more comment on entry points for accountability. So from BZ, they should start with inclusivity, representativeness, diversity, and the ability to reach the disparities and the poorest of the poor, as well as indigenous populations. Disabled persons, rural and distal populations, underserved and vulnerable populations. Programs which address these special populations listed above can be prioritized. Objective metrics can be put in place to measure impact and outcome. So let's move on to the next question. How can we coordinate civil society action at the global and country levels to take forward the outcomes of the HLM and the momentum for UHC created at the country level? And I know we've touched a little bit on this. And I'll go ahead and also read the next question in our discussion in case others want to chime in on that. What are the existing country level health advocacy or policy platforms that we can leverage to support UHC advocacy? So any information on any existing advocacy and policy platforms would be great, particularly from the country level.
Eliana, this isn't on the country level, but while we wait for people to reply, I did want to mention in terms of some global level discussions and plans, you know, what I think all of us recognize that throughout the negotiations on the HLM, there was probably not surprisingly a lack of, political will from member states to have an actual accountability mechanism or framework, at least at the global level, built in. I know there is some language which we've highlighted in our PowerPoint about the importance of sort of country level accountability for the work, but I think, there was advocacy around saying, just defaulting to the high level political forum, which is the global accountability mechanism for the SDGs, is not good enough. There are lots of issues with the voluntary national reporting, lots of issues with what governments actually bring to the table in terms of their VNRs. I know Ariana highlighted some of the additional, future moments that are planned in the UN system in terms of, a report in the coming years, and then the plans for a sort of follow-up high-level meeting in 2023. I did want to mention that for those of you who were in New York, we organized our CSEM meeting just before and in order to inform a meeting of the UHC 2030 Steering Committee, which brings together our civil society reps, but also representatives of donors, governments, UN agencies, the private sector, et cetera. And there was a meeting that UHC 2030 held, and the outcomes of that meeting will be followed up on at the next steering committee meeting, which is happening in December in Brussels. I wanted to flag, just in terms of global level work, that there were some discussions about producing a sort of state of UHC commitment and action report. We've looked at the work of things like the Independent Accountability Panel that exists for monitoring of every woman, every child, and looking at really the reliance on a broader range of, multi-stakeholder work to track accountability, to try to measure what countries are doing on the accountability front. So this was one suggestion, sort of an accountability report, and that takes a lot of work, right? As we saw from the Every Woman, Every Child process, that could involve a lot of consultants working at the country level. It's not that easy, right? But there is some desire to look at some specific tracking of, of commitments, or to look across the global health architecture, work with those that are doing the global action plan and other global health initiatives to promote a single accountability framework across different health reporting processes. So again, these were just some ideas that came up and that will be further discussed with the steering committee, but we do like to keep our CSEM membership updated on what's sort of being discussed at the global level, and then to look at how, I think as the CSEM, a lot of what we do is pressing to make sure that if these global level processes around accountability are going to be taken forward, that they start with input from the communities, from civil society, in those countries, from parliamentarians, and others, right? Rather than just remaining at the sort of WHO, UN level. So I don't have a lot more specifics on what the plans may be in terms of, reporting or high level advocacy with those other global health initiatives in terms of a coordinated reporting process. But I did want to flag it. And after that meeting takes place, the second week of December in Brussels, we'll be sure to update our membership and through our newsletter, et cetera, in terms of anything that comes out. So obviously, the political declaration didn't give us that kind of framework, but there seems to be some willingness amongst governments and partners to try to do something in parallel at the global level. Thanks.
Thank you, Amy. Yep, and just as Amy said, there's going to be a CSM advisory group and then a UHC 2030 steering committee meeting that's happening the first week of December. So if you are a member of the CSEM, through our newsletter and our website, we'll be able to report on sort of the outcomes of those. So just keep your heads up for that kind of information. I do have one comment from Bill and a question from Camila. So from Bill, so much disease is preventable: diabetes, cancer, cardiovascular disease, and many infectious diseases. UHC can be easier to achieve if disease rates are lower, but many health-related industry sections benefit from high disease rates. Surely this should be part of the conversation and building blocks for good health systems. I think we all agree on that. Camila, what are the processes now for agreeing on accountability mechanisms on UHC and strengthening them?
Sorry, this is Ariana unmuting. Um, so aside from the points that I mentioned about sort of upcoming processes around accountability, the focus right now in terms of the opportunity has been on national level. And, at the global level, the accountability is more on kind of reporting. So the progress report that's coming up, the report with recommendations on the political declaration implementation, the upcoming high-level meeting. I think also in terms of global accountability, linking with the high-level political forum and the voluntary national reviews, because this is tied into the overall Sustainable Development Goals framework. That high-level political forum and the voluntary national reviews are, linked sort of SDG accountability mechanisms. So at the global level, those are available. As Amy mentioned, there has been some talk about exploring, I guess, a mechanism like the Independent Accountability Panel, but no plans in place. So just to refer back to the slide that we talked about with the political declaration follow-up, those are some of the pieces that are in place currently.
And I do think on the prevention front and also on that question about sort of what are the processes for UHC accountability, we're looking specifically at the upcoming moments at the UN that are UHC focused, right? So the next big meeting in 2023. But I do know from our colleagues who work in the HIV and TB spaces, for example, that there will be other upcoming high-level meetings. They have their sort of review meetings coming up. So I do think in each of those spaces, it's important not to sort of keep the fact that these, high-level meetings have happened on vertical health issues or on UHC separate, right? There are opportunities each year at the UN where reviews of progress on these health issues are being made. And that includes also at the HLPF, the next time they look at SDG 3, we need to bring into those spaces what was promised at this UHC HLM. And then, yes, as Ariana said, I think at the country level, that will vary. I know BC and others have been sharing the existing UHC, pilots or health insurance schemes that happen in a number of countries. I think it'd be really, those pilots are happening. There's some media reporting about the pros and cons of it. It's interesting to hear. It would be great to learn from our CSEM colleagues who are in those countries where some of those processes are moving forward, if they've specifically had entry points to feed into the implementation of their national UHC programs. I think, agreeing on what UHC accountability will look like at the country level has to involve civil society, but we know we may often be left out of those pilot processes.
And just to say on the high-level political forum that because it's not all 17 goals every year, as Amy pointed out, SDG 3 is slated for the 2020 high-level political forum. And then just to reference also the global monitoring report on UHC, the one that was published this year around the high-level meeting is the third global monitoring report. And CSEM was in conversation with WHO in early days to ensure that there was some kind of focus on leave no one behind, which resulted in the commentary that CSEM developed on the latest global monitoring report. So just to flag that as maybe a lowercase a accountability approach, but that's certainly an opportunity as well.
I do want to be mindful of everyone's time. I think this was a really wonderful discussion. So thank you everyone who participated. Again, if you do have any other activities that you're doing post-HLM that you want us to highlight in our newsletter, If you want to find partners that you can work with in your own countries, please visit our map. We're updating that regularly. The other thing I just want to mention as a next step, here's some information about the CSEM, how you can follow us and how you can join us as a member. As I mentioned earlier, as a next step, what we're going to do is go ahead and post this presentation and the recording on our website. We'll send it out to all of you, and also send it out through our next issue of our newsletter, so people who weren't able to attend will be able to listen in on this discussion. And if you do have any other questions that we didn't get to today, again, feel free to email us and we can respond to those. And I just wanted to thank everybody again so much for such a great discussion. It's always wonderful to be able to hear more from our civil society members, and we're really happy that you were very engaged in this conversation. So thank you very much. And I do also want to thank Ariana and Amy for the presentation and the great discussion. So thank you, everybody.
Thanks so much, and looking forward to continuing the conversation with everyone.